Losing a loved one to illness or injury is never easy, but imagine if that loved one is a child. Here at Kapi'olani Medical Center for Women and Children, we strive for positive outcomes for all of our patients, but sometimes that isn't the case. When families are about to lose their child, their grief is unimaginable. Our palliative care team has developed a bereavement program to help these families cope with their grief.
We'll get a baby that we know has a life-threatening injury or diagnosis that we know potentially will die. So we start dealing with it before the baby even gets to that point. We know already this could happen. We have a palliative care team in the hospital that's alerted also, that starts to work with the family. And if we know that baby is going to die, we start to try to create memories for the parents with pictures and just getting them involved in as much as they can.
What started out as an effort by Sharon O'Hara-Katras to help grieving parents has now become a full-blown program that serves Kapi'olani's entire inpatient population. Sharon has been with Kapi'olani since 1978 and is currently a charge nurse in our neonatal intensive care unit, or NICU.
Sharon is a very compassionate and caring nurse. She just exudes warmth with her families, her patients, and even her coworkers. So people just kind of gravitate towards her. So she took it upon herself in the first week after the baby passed to make a phone call to find out how the parents were doing. And then within the first month of passing, she also wrote a card to remind them that we're still caring and thinking about them and the baby. And she used the baby's name, so it's not just your baby, which was an added personal touch. And she just started doing that on her own. No one asked her to do that, and that was just remarkable. And now we have a program that is very similar to what she started in the NICU.
The Butterfly program is a program of bereavement through the various units in labor and delivery, the pediatric intensive care, the newborn intensive care, and now they're expanding it to the women's service, you know, with patients that might die, and pediatrics with the oncology patients. This, for example, is one of the butterflies that is a symbol for death and dying. If we know there's a patient that is imminent, we'll hang one of these near the bedside to alert other staff members. They put these on the mother's room also so that if she's had a loss, someone doesn't come bustling in, and just to make people more aware. We give this to the family also to take home. On the back it says, "Made with Love by a Kapi'olani Crafter." We have a wonderful volunteer program. They make us beautiful quilts that we give to each family. They make us these little envelopes that we put mementos in for the family to take home. If the child has been here long enough, they have stuffed animals and toys like that. And then we have memory boxes where we put things in. They can put a picture of the baby in here and any mementos that they want. And then we make a clay footprint mold or a hand. I think it shows how much the hospital cares about their patients and their families and realizes that the suffering and anguish doesn't end when they leave the hospital. So it's a terrible situation, but if we can make it a little easier, not as painful, we'll never take away their pain, but just knowing that people care and follow up. I can't tell you how many people have written back to me after I send a card just saying it meant so much that somebody remembered. So
Sharon is one of our most senior nurses. She's one of our most experienced nurses. So from a nursing perspective, if I have a very, very sick baby, I want her with that baby anyway, just because she's such a phenomenal nurse. And then outside of that, she just has a very grounded personality that I think a lot of us would like to have, to where she's able to really stay there with the family and help them cope through a loss.
I think a big difference that this hospital makes is that the people that work here genuinely love children and babies. And that's reflected in the care that we give and the care that we feel for these children and babies. I mean, personally, I love babies, and I always feel so honored that I get to work with them. And I think that's how most people feel that work here. I think it makes a big difference.